Okay, this is my intramuscular return. I'm in my correct uniform. I have my badge, my stethoscope, pen and pen light, and my watch. I'm going to start out in my med room. I'm going to wash my hands and locate my MAR. Looks like I will be giving sodium chloride 0.9% today. So I will find my vial and check the expiration date. 05/2029, so this is good. And then I'm going to start my first 6 rights. So I have Fanny Fundamentals, 11/3/1955, no known drug allergies, receiving sodium chloride 0.9%, 1.4 milliliters, intramuscular, stat. So for 1.4 milliliters, I'm going to choose this 3 milliliter syringe. It has a 23 gauge 1-inch needle on it. I'm also going to grab a replacement needle of the same size. I'm going to start writing my label. So I have Fanny Fundamentals, 11/3/55, sodium chloride, 0.9%, 1.4 milliliters, intramuscular. The date is 11/25/2020. Time is stat. This was added by me. This medication is not expired. Now I'm going to get ready to actually draw up my medication. So I'm going to cleanse the top of my vial for 15 seconds. And then I'm going to open up my syringe. I'm going to draw up some air to put in my vial. I'm actually going to do more air than I need, so I have room to get out any bubbles. I'm going to go ahead and inject that air in and draw up my medication. And check for bubbles. Just a couple. The right spot. Alright. At this point, I would engage the safety device on my syringe, but I'm running out of supplies, so I'm actually going to recap it. And then I'm going to switch to my replacement needle. So maintaining sterility, I'm going to take this one off, open up this new one, put this new one on, put the old one in the sharps container. Now I'm going to perform my second 6 rights. So I have Fanny Fundamentals, 11/3/55, no known drug allergies, sodium chloride 0.9%, 1.4 milliliters, which I have, intramuscularly, stat. So I'm going to go ahead and put my label on. Not going to cover up any of the markings on my syringe when I do this. Then I'm ready to go into my patient's room. Get rid of all these extra supplies here. I'll take my MAR, my medication, an alcohol wipe, and some gloves. Here is my patient. So, knock, wash my hands. Hi, my name is Lainey. I'm going to be your nurse today. Can you please verify your name and your date of birth for me? Fanny Fundamentals, 11/3/55, matches my chart. Okay, Fanny, and do you have any allergies? No known allergies. Wonderful. Okay, we're going to be giving you your sodium chloride today. That's going to be an injection that we're going to do right over here in your thigh. Alright, I'm going to go make sure that I have everything that I need and we will get you all set up, okay? Alright, at this point I'm going to do my final check. So I have Fanny Fundamentals, 11,355, no known drug allergies, receiving sodium chloride 0.9%, 1.4 milliliters intramuscularly stat. And now I will show you. I don't know why that's looking like a bubble, but I think it's just a reflection because there's definitely not a bubble right there. Let me see if I can, there we go. Now you can see there's nothing there. Okay, and my label is on there. Okay, so I'm going to open up an alcohol swab, loosen the cap on my needle, maintaining sterility. Okay, then I'm going to put on my gloves. Okay, then I'm going to Z-track. I'm going to pull that skin taut on her thigh. The way that I chose this spot on her thigh is I did one hand breadth below the greater trochanter and one above the patella. Then I split that thigh in half anteriorly and laterally, and then I split that into 3 different sections, and I'm going to give my injection in that middle third right there. So that's the site that I chose. I'm going to pull that taut, and I'm going to clean in a circular motion from my site outwards. Alright, then I'm going to get my syringe. Fanny, you're going to feel a little poke. I'm going to dart my syringe at a 90-degree angle. Then I'm going to aspirate for 5 to 10 seconds. Make sure I'm not in a blood vessel. I don't want any blood to come back into the syringe. So I don't see any blood. I'm going to go ahead and inject my medication slowly, about 5 to 10 seconds per ml. Once I'm done injecting, I'm going to keep this needle in for about 10 more seconds. I'm going to withdraw my needle, release my Z-track. At this point, again, I would engage my safety needle and put it in the sharps, but to save supplies, I'm just going to recap it. Put that in sharps. I'm now going to check for any oozing or bleeding, which I would then dab with a 2x2 gauze pad. Alright, Fanny, you are all set. So I'm going to dispose of my supplies, remove my gloves, wash my hands, and leave her room. Now the other sites that you can give an intramuscular shot are in the deltoid muscle. So you'll go 3 finger breaths below the acromion process, and you're going to also stay above that axillary fold. So make sure that you don't go above or below those 2 spots. And you're going to give your injection right here in this triangle. The other site that you can give is the ventrogluteal. So what you're going to do is you're going to take the palm of your hand and place it on the greater trochanter. Find the anterior superior iliac notch with your index finger. Keep that thumb pointed at the groin. Then you're going to slide these last 3 fingers posteriorly along the iliac spine, and you're going to give your injection in that triangle right between these 2 fingers. Alright, that's all I have. Thank you very much.